Okay, well, I am truly humbled and honored to talk to such great minds this morning. As Michael said, I am not Dr. Klinghardt. Dr. Klinghardt was unable to make this event, and since I was local in Germany, seeing patients there with two oral surgeons I work with in Germany and Switzerland, I was asked to step in and give this presentation. So please bear with me because it was a little last minute. But I'm very excited to give a presentation about a topic so near and dear to my heart. So I've entitled this presentation, Seeing the Biophoton Field, the Diagnostic Prowess of Muscle Testing Depends on Water. Now, on one hand, there should be a question mark behind that statement because it's only a theoretical assumption. On the other hand, how could any biofeedback system not involve water? And I'll revisit that idea after presenting a bit more what the system of testing actually entails. Is anyone in the audience familiar with Dr. Klinghardt's work in autonomic response testing? Okay, great. A few of you, okay. So ultimately, my goal during this presentation is to raise awareness of this system of testing that we call autonomic response testing, that anecdotally works so very well for us and greatly aids practitioners like myself in unraveling the obstacles to cure our complicated patients face. So the subtitle of this talk is A Theoretical Discussion of Autonomic Response Testing and its Relationship to Water, or what we might call the liquid crystalline state. A little bit about me. I'm a naturopathic doctor, which means I went to medical school that was vitalistic in nature, which embraced the inherent belief that patients could heal, given the right environment internally and externally. It's unfortunately a shocking concept to many medical practitioners and patients who have lost touch with this inherent reality. These days, I'm a solo practitioner. I consider myself a very free thinker, and I have absolutely nothing to disclose. Thank you. Other than the fact that I've been out of academia for a while, and I spend my days talking to patients about their poop and their pee and their emotions, and so you'll have to forgive my layman's terminology during this discussion. This is one of my favorite Upton Sinclair quotes, and a reminder of one of the quirky human reasons we've gotten ourselves into this mess. It's difficult to get a man or a woman to understand something if their salary depends on their not understanding it. So how do I approach the complexity of the human condition? How do I attempt to unravel serious pathology in my patients? How do I approach a neurological patient like a multiple sclerosis patient or an Alzheimer's patient or an ALS patient or a Lyme disease patient? Or what if that patient defies diagnosis of Western terminology or treatment? How might I help a patient or diagnose why they are not getting well? Well, I do that with autonomic response testing, and every day I enhance my physical exam of a patient and clinical skills with these simple tools: signal enhancers and a pole filter. Yeah, that's a regular old-fashioned pole filter from a camera. So I'll explain that a bit more in a short moment. But what I write here is, what if healthcare providers had an inexpensive, quick tool, an accurate method for comprehensively evaluating a person's state of health in real time? What if that system also provided an avenue to evaluate effective treatment options and to differentiate between ineffective or unsafe treatment options? When we work with the biophoton field of a patient, we really have a quick learning tool, a quick learning curve to understand their system and understand what needs to be done for them. So just a little background on the name autonomic response testing. Dr. Klinghardt has referred to this system of autonomic response testing because it was a way of addressing the autonomic nervous system in a way that was superior to the tradition of applied kinesiology. His early embrace of German biological medicine and neural therapy taught him that the autonomic nervous system is responsible for normal bodily functions, abnormal adaptations to health problems. But I would actually argue that autonomic response testing goes far beyond evaluating the autonomic nervous system. In reality, it can assess most phenomena in the body because it is an interaction with a person's biophoton field, communicated via water structure changes in the body. So applied kinesiology is very different from autonomic response testing, and I actually very rarely call what I do muscle testing because the phrase is so misleading. So the main principles in understanding the basics of autonomic response testing that kind of go beyond the current consensus reality, or at least beyond the consensus reality of current modern medicine, are these things here. So the existence of a biophoton field, the phenomena of direct resonance, and water as a vehicle for information storage, or understanding water structure as an expression of health states. So the biophoton field, I think this room is well acquainted with the concept, which is great. Most doctors never hear about the biophoton field, don't believe it exists, which is kind of amazing. But most importantly to autonomic response testing, Fritz Albert Popp taught Dietrich Klinghardt that light comes out of the body in a polarized fashion. So any living organism, as he says, is emitting highly polarized light. This light is polarized in a concentric oval arrangement, and the long axis of the oval being parallel to the long axis of the individual organism. It's a polarization angle or mid-axis. When a cell, group of cells, or an organ is disturbed in its health, the polarization angle changes. It moves in a clockwise fashion away from the normal angle or O-axis. So you can imagine it similarly to the Alex Gray photos that I had on the first page, that Alex Gray artwork of the biophoton field, which is quite beautiful. So I think this is self-explanatory to this crowd, but I'd like to expand using Dr. Klinghardt's words of what Popp taught him. So the coherent field of the low-intensity light emissions inside the cell is the central regulating agency in the cell. The coupling and interference of the individual fields forms a common shared field in which the entire organism is embedded and orchestrates all the functions of life. This holographic field of standing waves, which are capable, with the help of broad spectrum of frequencies, polarizations, degrees of coherence, and squeezing of the waves, to communicate signals to any place in the organism in close interplay with all material structures. The involved physical structures, such as microtubulin, are designed as antennae for the reception or broadcasting of these signals. The central storage container and sender of this coherent biophoton emission in the cell is the DNA. The spiral shape of the DNA is an ideal light storage arrangement because through rhythmic contractions it can store and emit light. The DNA works together with a hierarchy of other light-active molecules and forms the network of light metabolism. Now I present the phenomena of direct resonance, and this was taught to Dietrich Klinghardt by Dr. Amora, who found that a substance placed over the skin or within the energetic field of a person resonates with the identical substance inside the body of that person. So Dr. Amora brought this application of direct resonance into its pure form back into modern autonomic response testing, and the type of autonomic response testing that Dr. Amora does is called the O-ring test, which looks something like this. It's testing the muscle strength of the pinky and the thumb. And he holds a U.S. patent on this particular way of using the phenomenon. It has been researched extensively. A lot of research was published in the 80s on this phenomena, and he calls this phenomena the resonance phenomenon between identical substances. So now, why does a muscle weaken or become more fluid with the phenomena of direct resonance? I think many of you would be able to give a more scientific explanation, and I implore you to do that with me. But I think Mei-Wen Ho would say, because the organism wants to dance. that the molecules may become more active in preparation for interaction. And one of my favorite quotes of hers is, "Quantum jazz is the music of the organism, dancing life into being." This is from one of my favorite lectures of hers, Quantum Coherent Liquid Crystalline Organism. Geologists use the polarizing microscope to identify rock crystals. We have slightly modified the setting, but the principle is the same. The rainbow colors are generated by crystals with orderly arrangements of atoms and molecules. We were puzzled at first. In rock crystals or liquid crystals outside the organism, molecules and atoms certainly have an orderly arrangement that stays ordered because there is no movement. But in the living organism, nothing is static. The molecules and atoms are moving all the time. So how can they maintain the molecular order required to generate the brilliant crystal colors? You will notice in the video sequence, and she shows her rainbow worm sequence, that the most active parts of the organism are always the most brightly colored and hence most like crystals. She says the only explanation is that the molecules are moving coherently together, so much so that they appear as ordered as static crystal. To cut a long story short, the molecules, especially the big ones, macromolecules like proteins and nucleic acids, thoroughly infiltrated with water, are in a dynamic liquid crystalline state. To begin with, they are completely aligned with their electrical polarities to form a continuum that links up the whole body, permeating throughout the connective tissues, the extracellular matrix, and into the interior of every single cell. More importantly, all the molecules, including the water, are dancing together as a whole, and the more active they are, the more coherent, hence the brighter colors, and hence, I would say, a weaker muscle or more fluid muscle. So what does this all mean for autonomic response testing? Let's get back to the pole filter. So the idea of using a pole filter in bioenergetic testing was conceived by Raphael von Asche in the mid-70s and went from there to Paul Nogier in France and to Dietrich Klinghardt. And Dietrich optimized the use of the pole filter as a means of determining if a person's system recognized this polarized light as similar to their own light via this phenomena of direct resonance. And using the indicator muscle, Dietrich always used the deltoid muscle as his biofeedback tool. So these are Dr. Klinghardt's own words from one of the ART learning books, and again, summarizing these basic steps of using autonomic response testing. So again, autonomic response testing is an extension of the physical exam. Muscles become tight when stressed, relax when not. So when someone dies and loses all the energy in their body, of course, they go into rigor mortis. They get very tight muscles. We're looking for the opposite. And this muscle difference can be perceived and graded by a skilled practitioner. We monitor the response of the motor matrix to arousal levels in the autonomic nervous stressors. All phenomena observed during the ART practice is rooted in this truth. So if a challenge is offered to the system, stretching a joint, thinking of something, one's mother, a family member, a stressor, etc., placing a substance into the field, it causes reactions, responses in the body. Again, Dietrich wrote here, mediated by the autonomic nervous system, which may or may not be completely accurate. And I will demonstrate this. And he writes, how a substance is recognized by its mere presence in the field is still a matter of discussion, but can be understood without violating one's common sense by applying our current understanding of the ANS and muscle physiology, physics, quantum physics, and biophoton physics. So when Dietrich demonstrated the emission of polarized light from the body using just a pole filter and an indicator arm, as we do in autonomic response testing, Fritz Albert cried because of the simplicity of it. And this was about 15 years ago in Medicine Week, after hours at a hotel, which is kind of a beautiful story when you hear Dietrich tell it. But I would like to demonstrate just that. Gerald, can I use your arm? And maybe we should bring up a chair because you're tall. Let's bring that chair up. Thank you. And you can just sit there.
Cure my laryngitis.
All right. Okay, so this is simply just what we call a signal enhancer. It's just amplifying light emission. So I would put this in his field, and I could put this really anywhere, but putting it at the heart chakra or the crown chakra tends to be the best. But for now, we're just going to put it here. And I asked Gerald to resist my downward motion, or just to create a kind of stiff arm. And so I want to feel what his arm feels like when it's in a strong state. And now I'm simply going to introduce the pole filter into his field. So again, this is a pole filter, just it's polarizing ambient light in the room. And I'm asking his body, do you recognize this polarized light? Is it the same as what's coming out of your body? And Gerald's body tells me yes, that I get a slight change in the strength of his muscle. I get a weaker muscle, a more fluid muscle. And that tells me that his body indeed recognizes the polarized light of coming through here with what's coming out of his body. And that's the initial basic and fundamental first step of autonomic response testing. So, are there any questions about that? Does it make sense to folks? Okay, great, wonderful. So this is really valuable information because let's say I found Gerald in a block state, so his body did not recognize this polarized light. So that would tell me that the light emissions from his body are not coherent, and they're scattered, they're fragmented, they're stressed. I want to know why his biophoton field is stressed. And I can also use this phenomena locally in the body. So he tells me he has laryngitis, so I may look at the throat, and I go out from the throat chakra or the area of the throat, and I get a block right about here. And so in this understanding of how the hologram of the body forms around the body, of course, when we're on the organ level, we're on the organ level, but as the light emits from the body, we get a holographic representation of the extracellular matrix about this far out, and we got a holographic representation in a concentric circle of the intracellular matrix about this far out. And so with Gerald, I actually get a block in his extracellular matrix about that level. And so then I might explore, well, why is that the case? And I can also use my hand there. So again, I get a soft arm with the pole filter on, and I get a block right here, just using my hand as the instrument to stress his system. So let me continue for a moment. If you could sit there, I'm gonna continue. So a lot of people ask, well, how accurate is this system of testing? I mentioned anecdotally it's very promising for us and very helpful, and certainly we see a lot of amazing results with it. But recently, earlier this year, a lovely paper, the title was cut off, was published. Dietrich Klinghardt and a colleague of his, Marco Ruggiero, who is a researcher of GCMAF. If any of you are familiar with GCMAF, we had a conversation at dinner last night, a couple of you. And they really wanted to look to see how accurate this was. And of course, the first 30 years of Dietrich's career, he really didn't know. I mean, he found, for example, resonance of certain bugs within people's bodies. We can use CDs with viral frequencies on them, or we can use slides of bugs to see if they resonate with the body and if they are indeed within the body. But sometimes the antibody response, so the blood work didn't come back seemingly accurate. And it wasn't really until the advent of PCR testing that we could actually test for the DNA of these bugs that it actually started to look as like, wow, autonomic response testing is incredibly accurate, and it's actually so much more detailed and so much more specific than actually what most blood tests allow us to find. Now, Dietrich Klinghardt and Marco Ruggiero went a step further because Marco Ruggiero is an expert in ultrasound. And so he uses ultrasound to sort of stimulate tissues in the body and get more bugs to come out. So, for example, Lyme disease or Borrelia burgdorfia likes to live in the joint spaces. And if you ultrasound those joints, the bugs will come out of hiding, and you can actually collect the urine of a patient after such a stress or a stimulus such as ultrasound, and actually test that urine via PCR testing to look for the DNA of these bugs. And so this is what this paper shows, is that actually when we can really correlate what we find with autonomic response testing very closely with such a sophisticated analysis such as this ultrasound simulation with PCR testing. But of course, I could talk for a long time about how clinically useful this is. Does anyone have Divinia water or structured water in the audience? Stephen, do you have any on you? No? I would love to show how certainly Divinia water or just structured water might help the laryngitis that you're experiencing right now. Have you drank any structured water this morning? No. Okay, so that's what... But I might, of course, look at other tools or other treatments and show how if I put that treatment simply in his field, the stress of the laryngitis would go away. And that is what would tell me what is an appropriate treatment. Whereas if Gerald went to a primary care physician, oh, lovely, yeah, we have something. Thank you so much. Oh, do you have any prepared water? Yes, perfect. And do you want to put it here? And that would be great.
Try to place his crystal.
Okay. Yes. Okay. We could have all sorts of fun this morning with this crowd. Okay, so we have a crystal here that I've been asked to test. So actually, immediately what happens is Gerald goes into what we call a yin state. Thank you. I'll test that one in a minute, too. And so that's the phenomena. So instead of having a strong muscle like I had before, he has what we call 2+ yin state. So I use 2 yin mudras to demonstrate how strong that yin state is. So this would be something that is quite good for his body. So thank you. I like that in my field. Do you mind if I keep it up here? And here's another example. So we were given, Gerald, could you hold that? And we'll see if we can coordinate this as well. So I don't get a yin state, but I recheck that throat chakra, and indeed I don't get the initial stress that I picked up. So again, I take this away, and I can check again. The stress comes back. I get that strong arm in the extracellular matrix, and I bring the water back, and that stress goes away. So two nice examples of 2 effective treatments for Gerald in this case. I think you should drink this. There are many other systems of biofeedback utilizing similar principles, and certainly autonomic response testing is not the only one. There's arm length testing. Like I said with Dr. Amora, there's the bidigital O-ring test. There's electroacupuncture from FOL. Heart rate variability, the nausea pulse, and even holographic dark field microscopy would be considered other examples of biofeedback using the biophoton field. So again, there are many practical differences in how this phenomenon of direct resonance and muscle change manifests in clinical practice when using autonomic response testing. When I test a patient, I really like to think of Mayo and Ho's explanation of the body being liquid crystalline, and it's like testing a crystal, and every human, every patient is its own universe. And it's amazing how the layers of stress or the layers of what I can find in a patient using autonomic response testing. With patients, I often describe the strong arm and weak arm as a binary system of zeros and ones that I can deduce all this information from to create a picture in my mind's eye of what stress exists in a body, but that's not terribly accurate either, but it's a decent way of thinking about it. And I just like to emphasize that strong arm doesn't mean good and weak arm doesn't mean bad, or vice versa. It's used within interpretation of the system, and specifically using the pole filter. And that's why this system of testing is so different from, for example, applied kinesiology, because applied kinesiology came from the mindset of the chiropractic tradition and looking at subluxations in the spine and seeing where nerves were impinged and seeing where muscles were not as strong as they could be because of that. A very different system of muscle testing, very, very different. In this system, there's so many variables: the length of time that the muscle changes, the quality of the muscle even, the length of time that we are feeling the organism changing its coherent field differs greatly. And this can be all interpreted by a physician, which leads me to say one of the most interesting things about autonomic response testing that Dietrich Klinghardt discovered is that when you cover the third eye of the practitioner, that it becomes very skewed, the results of this testing. And how interesting is that? So now we have research showing that the biophoton fields of people's brains interact with one another, of course. And we theorize that it's this biophoton communication between practitioner and patient that actually matters quite a bit, which is very fascinating. So again, there are many nuances to the system of testing. The body in water is so dynamic. It's changing constantly. One easy example of that is today I find Gerald in open regulation. And if I continued to test him every day over a period of a couple weeks and I found that every day he had open regulation, I'd be pretty happy about that. Versus a patient, if I tested them every day for the next couple of weeks and they had blocked regulation, meaning their body was not emitting polarized light, I would be concerned about that because their bodies were, it would say that they were in a stress state every day that I tested them. And I would want to know why. And we can use many simple tools to extract deeper levels of information. A mirror is one of the easiest, simplest to demonstrate. So if I just use a cheap mirror from a drugstore, I can look at deeper levels of Gerald's biophoton field, if you don't mind. And so one of the things that I use the mirror for is testing the brain. Frontal cortex shows up here, so I get a stress response in the extracellular matrix. And just put your hand on your forehead, Jerry. Which one? This one, yep. And then move a little further out. So in this case, the frontal cortex often represents an emotional blockage. We won't get into that right now. But I'll just tap his small intestine meridian. Small intestine is about loneliness. You might be missing Emmy. We understand. Okay, great. So that's just an example of how I might use a mirror to get more detailed testing. So, okay, thank you. So how could autonomic response testing be better studied? We heard yesterday about aquaphotomics. Maybe that is a great way to study it. Does science exist to explain all the phenomena we see in autonomic response testing? We heard yesterday about the quantum coherent water, this beautiful theory, this beautiful presentation yesterday, which I think is quite relevant to this. And other than that, I would like to thank you for your time and your attention.